What can we do for you?
Well, this is Sam, and he is a 25-year-old male. He was an unrestrained driver. You're getting your pre-hospital report now, so
Okay.
he's not here yet.
Okay.
So your EMS pre-hospital report, 25-year-old male, unrestrained driver, involved in an MPC, high speed, head-on, major damage to the vehicle, and there was a prolonged extrication. He goes in and out of consciousness. Class count is 11 at this point. He has a blood pressure of 84 count, heart rate of 120, respiration is 28 and shallow, and SATs are 91%. The pelvis seems unstable. He has oxygen on by non-rebreather. He has a seat collar backboard, 1 IV, and he will be here in 3 minutes.
Okay.
So what do you want to do?
I'm going to be the primary nurse. Pam, you're going to be respiratory. He's on a non-rebreather. Go ahead and get an ambu ready just in case. It's Annie. You're going to do our reporter. Yep. Mary, you're going to put him on the monitor. And Madison, you're going to start as the second line and help manage IVs.
And what level of activation would he
We
be?
want to maybe go ahead and put his sheet down since his pelvis is unstable so that we can wrap it and split it.
Okay, all right. What activation would he make count?
9, 1, 2. What?
Okay, has a pressure of 84. Say 911?
Yeah.
Okay. All right, and what else are you going to do before he arrives besides assembling your equipment and signing your rolls?
Notify X-ray and certify the transport team so that we can, and then our PPEs.
Okay, all right,
So,
good, all right. So he has just arrived and comes wheeling into the room to you.
Okay, what's his name? You know?
His name's Sam.
Sam, can you hear me? Do I get a
Do an
response?
EMS report. Now, that's that EMS report or no?
Yeah, so when the EMS brings him in, what is your, what do you allow them to do?
Give them their EMS timeout.
Yes, thank you, okay.
Okay.
So they've done that, and now he's all yours.
Okay, Sam, is he respond to me?
Just in and out, it moans,
Okay,
he's
and
moaning.
I've got a good pulse.
Yes, you do.
Okay, and we're getting him on the monitor and getting a second IV line and checking the IV line that's in.
Okay.
And then we're gonna do our head to toe assessment. Do we have any head injuries?
He has some contusions there. How would you know if he had a patent airway?
Is he equal breath sound or
Okay, let's go
equal
back
rise
to
and
airway.
fall?
Yeah, go back to airway though. So start at A.
Is there anything blocking his airway?
Okay, there is vomit, broken teeth, and strong smell of ETOH.
Hi there, I'm Dr. Reardon. What's your name?
Oh, Sam.
Okay, so we're vocalizing.
I heard. Oh.
Okay. Our saturations are 91. Our trachea is midline.
He's spitting that vomit out. Yes, trachea's midline.
Okay. Breath sounds still
Suctioning. Okay, breath sounds are clear and equal. You do have some crepitus there if you feel on that skin on the left side.
Okay. All right. Our breath sounds are equal though.
They're a little bit diminished on the left side.
All right. Our stats are though 91%.
Yeah, right now they're 91.
Let's have a chest tube set up for us.
And is trachea midline?
It is, yes.
And then we'll have chest X-ray outside the door.
Okay, all right.
Heart sounds are.
Heart tones are good, normal.
Let's put him on oxygen right now.
Yeah, he's on non-rebreathing.
Okay, thank you.
His level of consciousness seems to be deteriorating.
Prepare for intubation.
Okay, all right.
They have a 7.5 tube ready to go. You want me to package
Then
them?
let's have a needle for decompression as well, doing for baby.
And then we have a live scope.
And how are we preparing for prior intubation?
14 days for intubation, so he's on oxygen already.
I have an ambu bag ready to go. I have, just don't want to take it out. Yeah, I have suction, I've been suction in his mouth. We have a 7.5 ready to
And
go.
we need to get
And we have a
some
live scope ready to go.
medications.
Okay, all right.
Accommodate.
Yeah, we have 30 of etomidate and 150 of Sux.
So have those ready.
Okay.
Madison. And do you have an update on the IV status here?
ID is painted, you have one by EMS.
And it has lab grabs and tubes.
Sure.
Our pressure is 84, so go ahead.
Your pressure is now 82 count with a heart rate of 128.
Okay.
He is intubated without difficulty and he's at 12 on the vent.
Okay. Alright, so you're preparing for intubation. I'm continuing my examination.
Second line in.
Belly
And
soft.
I'm gonna go get
Belly is soft.
Pelvis
Pelvis is unstable.
unstable. So we need to stabilize this pelvis. That may help with our issue here. Back examination.
Back shows some blood in the belly.
Now we have 2 units of cells here, right?
Yes.
Okay, so let's call for that.
Okay.
I think we go ahead and just start that resuscitation. Okay, are you
I got
ready
the
for
bag on.
intubation?
You mentioned doing the pelvis. Ladies, how are we gonna do that pelvis? What are you gonna use?
We're gonna take
Go ahead and do it.
Let's get
Go
those
ahead and do it.
sheets.
Alright, and then I've got my chest tube set up available.
Yep, you do.
I'd like portable in here as well. And we can go ahead and just probably place that chest tube given our hypotension, decreased breath sounds, and cover this over there.
So we're gonna lock him and push this put it under, so we can have 3 people to log roll. And you're gonna stabilize the head, so the count is on you.
We have 3 people.
You do the bottom half, you do the top half, and I'm gonna talk to the side.
3, 1, 2, 3.
And make sure we maintain C-spine while we're doing that. Okay?
1, 2, 3.
And then this way, just enough to pull it out.
1, 2, 3.
And then we're gonna,
Okay, check this out too at the same time.
oh, yes, you did.
Gave it just enough time.
And then, do we just tuck it? Or tie it? We tie it. Like,
So, one person pull one way and then.
no, tight, just tight. Like, really, really,
Yeah,
like,
yeah.
you wanna, like, make it
Okay,
perfect.
and then once you get it around his hips, where's the correct placement for that?
It needs to be, like, to get the pelvis,
Right, so the lower trochanter, kind of like a butt binder.
Okay.
And then once you have the pelvis done, what's the next step to binding that pelvis? Closing that open book? What else do you have to mobilize?
The legs.
Yeah, so put the legs together with tape or an ace or something, so it's all moving as one unit. Okay, so your pelvis is immobilized. And what size IV did you insert when you inserted your?
That's a 20 gauge, but I should put an 18, right?
It should be a 16.
Oh,
So for trauma resuscitation, go big.
Okay.
So if you get a 16 in, go for it. All right.
I'm gonna
Questions?
I'm gonna needle decompress because there's only one provider here. I'm gonna needle decompress before I intubate.
Okay,
Do that and intubate.
Yep.
And then the chest tube.
Okay. All right. So needle decompression shows you hear air from that, and then we have him intubated,
On the ventilator.
and then the chest tube. What size chest tube are we putting in?
Probably 36 French.
Okay, 36 French. All right, that is inserted.
Yeah.
What would
Great,
trigger?
yes, that's right there, right,
What
right.
would trigger the fact that you needed to do the MTP protocol? What are some things you're looking for?
For the what protocol?
The MTP protocol, what would trigger that you needed to do that?
Well, we need blood because he's hypotensive. We suspect there's bleeding on examination. This past exam is pelvis, mentation.
Okay, all right, good, good.
OG.
Blood bank gives you the 1 unit of blood then, so he has 1 unit of RBCs going.
So we better get
And we're doing that with what? How are we getting that blood?
rapid infuser.
Okay, warmed, correct? Okay, go ahead and set that up. All right, what do you want to know about his disability or the rest of it?
So we did, okay, so prior to our intubation, was he moving his extremities?
Yes.
Okay. We got equal pulses,
Yes.
equals, we did that.
Okay. All right.
And then we're also gonna put in an OG, since we've got him intubated and stuff, and since he was throwing up, we wanna make sure he's not
Okay.
still gagging.
We need our chest x-ray to come in, do a portable chest. So I've already placed the chest tube, so portable chest and pelvis.
Okay. All right.
We'll do an OG before we-
All right,
Yeah,
we'll,
we'll do an OG.
we'll say at this time, x-rays come in and done that, okay?
Foley in his bladder.
There will be no contraindications. What would be contraindication to doing the Foley?
If there's blood in the meatus.
Okay, all right, good. There is none, and you're getting clear urine back, okay? What's the next thing you do? What's the?
Well, he's exposed.
Exposed, okay.
So make sure everything's off.
You
and-
should have been off, everything
Yeah,
had been off
exactly,
next time I got
yeah.
here.
So what are you seeing on his legs and arms?
Abrasions.
Report. Abrasions and contusions, okay?
Do we see
Alright.
any deformities? We'll do our secondary survey.
No deformities, no.
Secondary survey.
And the family,
Tetanus update.
yeah, oh, good, tetanus, mention tetanus, right, okay. All right, so somebody's gonna report that we gave the tetanus. What as far as pain might we do for him? You know, on his pelvis and legs, what else?
I give some fentanyl.
Okay,
Depending on his blood pressure, we have to give him ketamine.
Okay.
Should be okay with the blood pressure.
all right. And what would be the definitive treatment for him?
Ship, transfer to Memorial
Okay,
for the
and
trauma.
when would that have started? When would you
Like
get
the second he came through the door.
Okay, good, 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 good. Okay.
Like, that's why Annie was on the
Yeah.
phone.
I was making phone calls.
You were, Annie was on it. Okay,